Welcome everyone. So I'm Saskia, the export manager for Deleo. First, I'd like to thank everyone for joining us today on our first webinar. We're very excited to launch different webinars and these sort of events. This situation of COVID-19 has allowed us to be able to use the digital lifestyle and be able to keep business running in this way, which is brilliant. The aim of today's webinar will be to present, explain, and discuss together Deleo's vision of aesthetic medicine. So it's a pleasure for us to have Dr. TAIMUR SHOAIB hold today's event. So I will pass him over for the presentation in a minute. I just want to say, for any questions, please put them through the chat and we will come back to them once the presentation is over. So I will now pass over to Dr. TAIMUR SHOAIB. So listen up and enjoy.
Well, good morning, good afternoon, good evening, wherever you are. Thank you very much for the kind introduction and for welcoming me. I am TAIMUR SHOAIB. I am a plastic surgeon. I work in the United Kingdom and I work in two main places, in London and in Glasgow. And I have had a Deleo crystal device in my clinics for about 6 or 7 years now, so I'm very comfortable using them. I'm very comfortable using them as combined therapy and as multiple therapy options for my patients. So it gives me great pleasure to talk about the innovative combining techniques for 360-degree body contouring with Deleo. And I want to start off by talking about the background of cryolipolysis. And we know the history of cryolipolysis. It has been called cold paniculitis, and we know that from historic reports of children in America, that's how it was first discovered, that fat freezing causes fat necrosis and fat apoptosis and fat reduction, because children in America were sucking ice lollies and they were putting them in their cheeks, and their buccal fat pads became less prominent on one side compared to the other. And as a result, this was then explored, and it was used as a means of therapeutic intervention. So we then realized that cryolipolysis produces a cold paniculitis and causes a reduction in the volume of fat. There is a mechanism for this, and this mechanism is cold temperature. We need to measure the temperature. We produce a vacuum as well in the treatment area to provide a good contact between the device and the cold temperature that we are producing. And the reliability of the equipment is very important in this manner, because we need to know that we're getting smooth, consistent, even results. We need to know that the device is not going to cause any complications. It is going to be effective. And so the technology is probably one of the most important aspects of cryolipolysis, much more so than perhaps some of the other things that we do as aesthetic doctors, as aesthetic surgeons, in terms of our skills and techniques. I do think with cryolipolysis, the actual device itself is one of the more important things that we have to use. We know that there are 3 mechanisms behind cryolipolysis, ultimately leading to apoptosis, in other words, programmed cell death of the lipocytes, of the fat cells. There is an inflammatory mechanism, an ischemic mechanism, and an endocrine mechanism. The endocrine mechanism is still a little bit complex and unclear, but the inflammatory mechanism leads to intra-adipocytic lipid crystallization, followed by cellular apoptosis. and this leads to release of triglycerides into the interstitial space and phagocytosis of the cells by macrophages. There's also an ischemic mechanism, which is important, and the suction of the skin fold compresses the terminal arterial vessels, and this is compounded by the vasoconstriction related to localized cold. So these are the mechanisms by which cryolipolysis works. And we do have contraindications as well. Patients with cold-related pathology, Raynaud's disease, cryoglobulinemia. Patients will have a variety of diseases and variety of conditions which may have an impact on our ability to perform cryolipolysis. And of course, as doctors, it is paramount for us to take a comprehensive history of the past medical history. And even when people don't have a diagnosis of these conditions, simply asking them, how do your hands feel on a very cold day? They will sometimes give us an answer, and it points us to perhaps a concern which we would be mindful of when we're performing cryolipolysis. We want to have precautions to consider during the consultation if a patient has a pacemaker or an implanted defibrillator, or if they have known heart disorders, and these are the conditions. If they have had recent surgery with a recent scar, if they have open wounds, skin conditions which may have an impact on the recovery process, these are the things that we need to be concerned about. And of course, this is a medical device and it has a medical CE mark. And so as a medical device, we always need to consider the fact that we are first primarily doctors. There are some complications associated with cryolipolysis. Thankfully, these are not too common. The commonest is pain which is protracted and goes on for about a week or so. Usually people are in pain for about an hour or so, maybe a day or so, very rarely any longer than that. And if it is going to be longer, it's usually for a few days after that. But we can get redness, we can get a vasovagal attack, we can see bruises, nodules, or diffuse infiltration of indurated tissue, so that the tissue feels hard or it can feel swollen. And as with all treatments on the skin, there can be pigment changes and loss of sensitivity around about these areas. Thankfully, these risks are low and they are temporary. There are some rare adverse effects, some of which can be more long-term and causing a burn to the skin. A cold injury is possible. Skin hyperpigmentation is possible, causing a brown color or a dark color. Hypoesthesia, meaning numbness in the area and reduced sensation around about that area, is possible. And paradoxical adipose hyperplasia, or PAH, is a rare complication, 0.72% in the literature. But it is when obviously the fat increases in the area rather than decreases in the area. And we're not completely sure of the mechanism by which this happens, but it is a complication. And obviously patients are coming to see us because they want their fat reduced. And if they wind up with a small bulge of fat in the area which is increased, then this defeats the purpose of the treatment. It's very rare. It's said to be more common in males. It's said to be more common in certain areas, for example, when treating the chest in males with gynecomastia. But it is something that we need to consent our patients about. We need to tell them of the possibility, and we need to be aware of this. So let's look at some clinical evidence. We obviously have the Crystal device. We now have a new Crystal Pro device, which is very exciting. And we want to talk about some of the medical studies that are out there where cryolipolysis with Crystal has been used for treatment. And we can see that the pinch fold thickness of the skin reduces considerably, and the amount of fat in the area reduces considerably as well. So we get a 30% average reduction of skin fold thickness, and we get around about a 20% reduction in fat thickness measurements, which we can do by caliper, ultrasound photographs, that kind of thing. And and the nice thing about this is that you can repeat it with surgery. You know, maybe we don't want to repeat surgery again and again and again, but with non-surgical treatments, we can, of course, reduce this. And if we're looking at circumferential measurements, we can measure the circumferential reduction following cryolipolysis, and an average total loss of the circumference of the perimeter of the abdomen, for example, is around 2.79 centimeters. And obviously in the United Kingdom and some parts of the world, we talk about inches rather than centimeters. So we lose an inch, which is very aspirational for some of our patients. And because we are allowed to do further treatments, there is no need for restricting our treatments to one treatment per patient. Then a patient's desire for repeat treatments is often very high. So let's look at some of the treatment plans and how we assess our patients. Clearly, we need the right indication. We can treat men and women of all ages who are in good health with no contraindications, as we've mentioned previously. And the pinch thickness should be greater than 2 centimeters. If you can pinch less than that, there's probably not enough fat for the cryolipolysis to work. We may cause skin complications as well as a result of this. And there are a number of areas around about the body that can be treated, as you can see from this diagram. But patients will often come to us with preferences to say, I'd like my chin done, I'd like my thighs done, I'd like my abdomen done. And I think these are the common areas where we treat, just because of patient preference. So what happens in the treatment? We suction the fat into the handpiece. Often the best indication is the abdominal bulge in the medial aspect of the abdomen, and we want to define the areas to treat, because we want to make sure that the areas that we are going to be treating are compatible with the system. We want to make sure that the skin that we can pinch, it fits into the applicators, because the success of the procedure is based on things like fat volume, the ability to suction, and fat sensitivity to cold exposure. And of course, there are some of our fat cells are sensitive to cold, and some of our fat cells are resistant to cold injury. So an ideal profile is a patient who is medically well, fit and healthy. They look after their diet, they exercise well, and they just have pockets of fat that are resistant to diet and exercise. This is the same indication for any kind of fat reduction therapy. And obviously, as a surgeon, I will perform liposuction, and it's the same thing. Pockets of fat that are resistant to diet and exercise. These are the ideal cases for cryolipolysis. So before a treatment is performed, we should take a history. We should examine the patient. We should ask them, what is it you don't like about yourself? What is it you're hoping to achieve? And I think determining the patient's needs is one of the most important aspects of what we do. We need to ask our patients what they're hoping to achieve. Some of them will say, look, I want my clothes to fit better. Some of them will say, I want to be more comfortable wearing a bikini in the beach. Some of them will say, I really look after my health, I really look after my fitness, but there's one pocket of fat that just will not move, and it will not shift, and it will not shrink, no matter how much I try and exercise in this area. And so we need to identify our patients' needs, because that is the aim of their treatments. It's not good enough simply to say, oh, you want some fat reduction? I can reduce your fat. Because firstly, it may not give them the amount of fat reduction that they want through one treatment. It may need to be repeated. And of course, we have to say this to our patients. And identifying the aims means that we can appeal to our patients' emotions rather than appealing to a physical result, because our decisions are made by emotions. We then explain the concept of cryolipolysis. We tell them to make sure that they any peau d'orange, any cellulite, cryolipolysis will not have an effect on this, but there are devices from Deleo which will address this, and we'll talk about this later. And we want the patients to have realistic expectations. A 20% reduction in pinch thickness is probably what we want to target in our patients, and tell them this is our aim. This is what we would expect to see. But of course, you can get it repeated. So it's maybe less effective than surgery, but of course, it's less risky as well. And there's no recovery. You come into the clinic, you have your treatment, you leave, you come back later, you come back a few months later, and you can have repeat treatments. No one needs to know. You don't need to take time off work. And nowadays, with the coronavirus and with COVID-19, surgeons are now also saying to our patients, before you have any surgery, we're going to test you and to see whether you have coronavirus, and then we're going to ask you to self-isolate for a period of time. So the recovery process for surgery in the new coronavirus age, I think, is going to be slightly longer. So we consent our patients, tell them about the potential side effects, and then we can go ahead with the treatment. There are many ways of determining how we are going to get a good treatment for our patients. We can ultrasound them, for example. And if we do ultrasound, and Crystal Pro has an ultrasound, if we ultrasound them, we can measure the fat thickness. And patients like to be involved in their investigations, in the whole treatment plan. At every touch point of the treatment plan, the patients are interested in their own well-being. They're paying for this. They want to know what they're paying for. And they generally are a very highly engaged group of people that we treat when they come to us for their aesthetic treatments. So ultrasound, I think, has a role to play, because it monitors the pre-treatment area. You can monitor the progress of the treatments, and it is an objective measurement of what is going to be performed. Obviously, we use a gel pad as well, and the gel pad protects the patient from cold. It improves the contact between the skin and the applicator. And of course, when we're applying the gel pad, we mustn't fold the gel pad. There must be no bubbles between the skin and the gel pad. So you really do have to apply it properly. And the handpiece must be completely covered by the gel pad. And the handpiece cannot extend beyond the margins of the gel pad itself. So I think this is quite an important aspect of how we perform treatments. Massage after surgery, after cryolipolysis, has been shown to improve outcomes following cryolipolysis. And although the numbers are small in this particular study, the reduction of fat was more effective. I think patients like to have their tissues warmed up, and they like to hear the cracks that we get from the post-session massage as well. It tells us that something is working. It improves the patient engagement process, I think, and of course, it is clinically effective as well. So the expected results, we tell our patients, look, is your fat cells will be naturally eliminated and reduced over a period of a couple of months, and we will take we will do our review in 2 months' time just to see how you're progressing. And if we are going to perform any further treatments, we'll do it at, I usually do it at 3 months. If anyone is doing treatments at 2 months, that is fine. I would be interested in hearing your experience, but I certainly do them 3 months later. And of course, we need to tell our patients to maintain a regular, healthy lifestyle. There's no point in losing pockets of fat that are resistant to diet and exercise, and then you stop dieting and you stop exercising, and your whole body becomes bigger again. So obviously, lifestyle changes and lifestyle maintenance is important, because our patients are usually maintaining a healthy lifestyle already, and we certainly don't want them to stop this. So let's talk about Crystal Pro now. So Crystal, I've had the Crystal device for several years, and what appealed to me was that there were 2 handpieces, 2 applicators, and the Crystal Pro now has so much more. One of the probably the most visually greatest difference is the fact that it has 4 applicating sockets, and so we can treat 4 areas at a time rather than 2 areas at a time. But it has so much more as well, and perhaps Saskia will tell us later on of all the differences. There are so many that I would have to apologize for missing out on all the differences. And this allows us to combine treatment areas for the face and the body, the abdomen and the legs. How many times have we heard patients say, look, I would like my abdomen treated, and my thighs and my arms and my chin, because these are pockets of fat that are resistant to diet and exercise. And this now allows us to do so much more in one session. And Deleo has a huge number of applicators that can be used on all parts of the body. There are small ones, thick ones, wide ones, flat ones, curved ones. There is a new one coming out for the inner and outer thighs, and I think we're all excited to see what is coming from Deleo's R&D system. I've used our Deleo system for many years, and one thing that does impress me about Deleo in comparison to so many other manufacturers out there is how they've evolved over the years and how things keep changing for the better. There's a new cooling system as well in the Crystal Pro. So the current system is very good, of course, and the new cooling system allows a greater degree of cooling to some of the areas of the applicators which previously were getting cooled from diffusion of cold and reduction of heat. So now the cooling liquid goes through the entire cavity of the applicator. There were 1 or 2 areas, small areas that were missed out with the previous applicators. I don't think it made any difference to our outcomes and our results, but clearly as technology improves and as R&D improves, then if there are others and new systems that can be used, then of course we want our manufacturers. As a surgeon, as a doctor, as a clinician, I want the manufacturers that I use to buy machines from, I want them to improve their products as the years go by. So that is the new Crystal Pro. We also have a new Crystal Fit. So we'll talk about Crystal Pro, Crystal Fit, and Crystal Diamond as well, which I think are 2 exciting developments from Crystal. So Crystal Fit, as it implies, is for muscle improvements, and it's high intensity focused electromagnetic technology. And we know that the muscles in our body, a proportion of the human body is made up of muscles, 42% in male and 36% in female. On average, clearly there are differences in different body shapes and body types. And currently, if you want to increase the muscle mass that you have, you got to physically work out. You got to go to the gym. You got to pump some iron. You got to lift some weights. You've got to exercise. And this is until now has been the only generally available method for strengthening one's muscles and increasing muscle mass. But we obviously have magnetic stimulation as an option as well, and this has a track record of medical indications. So high intensity focused electromagnetic technology. I'm just going to call it HIFEM from now on. So HIFEM uses electromagnetic fields. Now they're measured in teslas. So 1 Tesla is the magnetic field of the Earth, and an average MRI scanner, for example, is around about 4 Teslas. Research MRI scans produce 7 Teslas of magnetic fields, and the technology is based on physics, on electromagnetic induction, because where you get a magnetic field at right angles to that, you'll get an electric field as the wave propagates. So it's non-invasive, it's non-ablative. It can be used on top of your clothes. The applicator is simply placed on the body, and the electromagnetic waves they interact with the muscles, and this muscle exposure leads to muscle contraction and muscle strengthening. And currently, it can be used for buttock shaping and abdominal toning, and patients will have an improved core muscle as a result of this. Now, HIFEM uses a specific range of frequencies, which means that it's a very efficient muscle workout. There's no muscle relaxation between 2 consecutive stimulations. So the muscles remain in long, intense contraction, but they contract enough for blood to enter the muscle, so you don't get muscle ischemia, but you do get enough contraction to maintain muscle work, and as a result, it increases the muscle mass and the muscle strength. So after some treatments, then after a range of treatments, then we will see an average increase of muscle mass by about 1/6. So this is suitable for most patients. It's suitable for men, it's suitable for women, all ages. There is no downtime. It is 30 minutes per treatment, and people would be advised between 4 and 6 sessions. But the thing is, when a patient has this treatment, they like the treatment, the results so much, they will come back for different treatments, and they'll come back for more treatments. I think it is something that will be used much more extensively in our non-surgical practices in the future. And we do it twice a week, and here's some results after 6 sessions. It improves muscle mass, it improves muscle strength, it improves the resting tone of our muscles as well. And it means that when we don't think we're contracting our muscles are contracting in any case. The muscles, when following Crystal Fit, they're contracting just a little bit harder even though we don't, even though we're not actively contracting our muscles. So this is resting tone, and so resting tone of these muscles improves, and so the muscle shortens, and so you get a flatter abdomen as a result of this. So we've got Crystal Pro, we have Crystal Fit, and now we have Crystal Diamond as well. So we were talking earlier on about cellulite, and we were talking about the fact that with Crystal Pro, we don't want to tell our patients that this isn't going to improve your cellulite, because fat reduction techniques generally do not improve cellulite, not in the long term anyway. But cellulite can be improved using different technologies. So we now have Crystal Diamond for cellulite. Cellulite is caused by fat deposits in the superficial fat. They press and distort the connective tissue just deep to the skin, and you get characteristic changes in the appearance. It's more common in women than it is in men, because the superficial fat in women is more prominent and more prevalent, and it's because of the different distributions of fat, muscle, and connective tissue. And a very large proportion of women complain about cellulite. Sometimes the amount of cellulite they have is mild, it can be moderate, it can be severe, and it's important to grade our patients and give a magnitude of the pre-treatment effect, and we'll have a look at that later as well. So the diamond applicator offers cellulite reduction, skin tightening, a smoother texture, and body contouring. And it works with high-intensity focused diode technology. So this is 940 nanometers. It's infrared light, and this is selectively absorbed by the target tissue. And the target tissue is fat. We'll see that later on. And it causes release of stored triglycerides, but the fat that is targeted is superficial fat, which is what the cause of cellulite is. And it's ultraviolet light. And infrared light. And the thermal energy from this light, the thermal energy from infrared also acts inside the dermis. It causes collagen contraction, neocollagenesis, elastin production, skin tightening. We just cause a stimulation of all the good tissues and of all the good cells and all the good processes that are going to improve our cellulite. And we get fibroblast stimulation as well through mechanical aspects as well. So 940 nanometers is an ideal wavelength to help improve to help remove adipocytes. So with every light, we have a chromophore. So we often use lasers in our practice. We often use LED lights or IPL lights, and we know the concept of the chromophores. There is a tissue that will absorb light of a certain wavelength, and 940 nanometers. You can see from the graph, it is absorbed by fat. This is also well absorbed by water, and you can see the H2O graph in the green line there. And because it is absorbed by water as well, it allows heating of the tissues, and that causes the collagen remodeling, which is ideal. But it is protective for some of the other tissues, for example, hemoglobin. So we're not going to target blood vessels. We're not going to target nerves or any other kind, or melanocytes. So these are some of the visible results, and you can see an improvement at all grades of all types of cellulite. So if you grade these patients, the simplest grading method is to say mild, moderate, or severe, and you can see, I think all these patients have gone down by one point in that grading system after 3 to 7 sessions. So let's talk about and let's have a look at some of the patient experiences. Well, let's go back to how to analyze a patient. Now that we know that we've got Crystal Fit, Crystal Pro, and Crystal Diamond, when we analyze our patients, we can look at them in a slightly different way, because we know that we can target muscles, we can target fat, and we can target skin. So what do we see on this patient? Well, we see pockets of fat that are possibly resistant to diet and exercise in the flanks, in the saddlebag area, and in the anterior abdomen. We maybe see it in the banana roll area of the upper thigh, just below the buttock crease as well. What we also see, is a convexity in the lateral view of the anterior body wall, and quite possibly we would think, well, I think if we were to improve the core muscle in this area, if we were to improve the core strength of the muscles, we would see a flatter abdomen. And then the last thing we look at is there much by way of cellulite in this area? And there's probably not a huge amount of cellulite in this area. So primarily we have excess fat. Secondarily, we have a desire to improve the muscle tone. And thirdly, in this particular photograph, we would talk about cellulite. So the key to success is what we see and what we are going to do in terms of treating it. And we can consider structure, laxity, and volume. So with structure, we want to look at cellulite. Is there much cellulite? Is the skin smooth? Are there dimples that we want to smooth out? Laxity, do we have good muscle tone? Do we have good skin tone? And how are we going to address this? And is there an area of increased volume that we want to address as well? And here we can see the different layers of the tissues where we have different aspects of these three main concepts of structure, volume, and laxity. As we get as our body changes, we see weakening of the roof and weakening of the structures in the skin. We lose muscle, we gain fat, and the fibrous septae are holding things down. They just get a little bit loose in the deep areas, and the fat becomes more prominent in the superficial areas, and so we get cellulite. And in terms of structure, laxity, and volume, what we want to do is we want to think of these as three separate concepts, and we want to grade them as well. So a grading system, the simplest grading system you can come up with is mild, moderate, or severe. Not everyone likes mild, moderate, and severe, so some people say, well, it's mild to moderate, or it's moderate to severe. And we can then also have very severe. So however you decide to use your own grading system is fine, but it is very common for us to classify something as being mild, moderate, severe, or very severe. And we can do that for structure, which is cellulite. We can do that for laxity, which is skin looseness, and elasticity, which we need to improve. And again, we can have mild, moderate, severe, or very severe. And we can do this by pinching the skin. If there's a good bounce back, if there's good tone in the skin, we can be aware of that. And the last thing is when we look at volume, obviously we can examine volume at a static manner. In other words, let's have a look at our patients today, and we'll see what their body mass index is. We can see what they look like, but clearly we also want to make sure that that we're aware of the weight history of the patient over the course of time. For example, if a patient fluctuates in their weight, and sometimes their weight is too low, or their BMI is too low, sometimes their BMI is too high, then we need to know that, because that'll have an impact on the skin as well. So we need to know what our patient's BMI history is. We just ask them, is your weight stable or does it fluctuate? And you can have up to 8 differences in the body mass index of patients, and obviously this is an extreme case, but it does happen. So we need to ask our patients their weight history as well. So now that we have these three concepts of structure, laxity, and volume, which will define what types of treatments we will perform, then we can grade the magnitude of the structure, the laxity, and the volume issues, and we can target treatments with our patients for these particular concerns. So in this example, whilst there may be some intra-observer variability, I think most of us would agree that the majority of this is a structural issue. There's some cellulite going on, and there are dimples, and of all the imperfections that we see in this image, we would think, well, probably the lack of smooth skin is important. And look at the results. When you consider, I'm going to target the cellulite here first, and then I'm going to target some of the volume, and then I'm going to target some of the laxity. When you prioritize your treatment structures, this leads to better results. Again, here we looked at this earlier on, And we agree. Well, I have said that I think the main issue here is volume, and in the flank area and in the anterior abdomen, and you can see the improvement there. And I also mentioned, I think, some of the laxity of the muscles in the anterior abdominal wall, and so combination treatments has given this patient a much better result than we could get just from unimodality treatments. So combination treatments, of course, are the way forwards. And if you're a surgeon, you can combine surgery as well as non-surgical treatments, and you can combine different aspects of non-surgical treatments as well. In this patient, in the before picture, in the pre-treatment picture, you can see that most of this is laxity. There is some volume that we want to improve, and there is some cellulite that we want to improve. But really here, what we want to do is tighten the skin. And so the diamond here is ideal for our first round of treatment, and we follow this on with Crystal Pro and Crystal Fit in the buttocks. In this case, in the anterior abdomen, what would we say? I think it's mainly skin laxity here that we see. So we want to improve the tightening of the skin. We want to stimulate collagen production. We want to stimulate dermal thickening and dermal tightening. And when we prioritize our treatment for this patient with that, and move on to volume after this, then we see improvements in the right way for our patients, so that we can help achieve their aims. So the take-home message is that we should not perform treatment without assessment. We should assess our patients in terms of combination treatments and in terms of different modalities of treatment that we can perform with the different aspects of what we see. And so we have to come up with a treatment algorithm. And that treatment algorithm is based on our 3 technologies: Crystal Pro, Crystal Fit, and Diamond. The Pro being cryolipolysis, Crystal Fit being high-intensity electromagnetic stimulation, and Diamond being LED lights. Okay. Well, I'd be happy to take questions and answers, and I think, Saskia, you'd be happy to take questions and answers as well.
Absolutely.
I'm going to stop screen sharing. So,
perfect.
Can you see me again?
No, we can hear you. Okay. Yes, we can still see you. Thank you ever so much, Dr. Taimur, for the presentation. That was brilliant, very detailed, of all the different points that we wanted to go through, the message that we also wanted to put across to everyone listening to us. I'd like to say that there's about 60 people that were attending this first webinar, Dr. Taimur, so that's great. Many people listening to you and taking in all the new information that you've been presenting today. So thank you for that. Thank you for everyone who's joined us during the presentation, who came on. So that's really great for us. We hope it was all clear for you. And now I think we can take some time to go through some questions, because we've got a few that have come up through the presentation. So to start off with, we've got Farah, who's asked Dr. Taimur, why lactating women cannot have a crystal treatment? Why have we put that as a caution, contraindication? If you could explain.
It's because there have been no safety tests performed in lactating women. So that is the reason why. And it's very difficult to get ethical approval to perform studies on women who are pregnant and breastfeeding. And so because we cannot test the safety, we cannot recommend the treatment in that group of people either. Okay, so it's a precaution for the moment to not do it. I would also, so from a regulatory aspect, I would say that is the reason. But I would also say from a clinical aspect, if someone is breastfeeding, then it may be that their body is changing in terms of body shape. And so we possibly want to wait until all changes of their body have been complete before we embark upon body reshaping and body changing treatments.
Absolutely. I get that. I hope, Farah, that was a good explainable answer for you there. Farah has also asked us, Dr. Taimur, after liposuction, how long after do we have to wait until there can be a crystal treatment performed?
I usually wait about 6 months, because this is the length of time that it takes for the internal fibrosis and the internal induration that takes place around about the area that is treated to soften up completely. And so I usually wait 6 months. But it depends on what it feels like. And so I examine my patients at 6 weeks, and then I usually leave it another 6 months, and I examine them at 6 months. So at 6 months, I say to them, look, it feels nice and soft now. I think all your scar tissue has settled down on the inside. Clearly, there's always going to be scar tissue, but it's soft now. And we can grab the skin and place it into a cryolipolysis device. We can place it into the applicator. Prior to 6 months, it might be a bit painful. It might be a bit stiff. It might be a bit scarred.
Okay, brilliant. So definitely minimum 6 months. Obviously, during a consultation, every patient can be different, like you said. So really check on the scar tissue, how it reacts after that. The thing is,
with liposuction, we preferentially target the deeper fat layers. So you saw in one of the pictures that there was a transverse section through the skin, through the tissues. There was skin at the top of the picture, then you had the superficial fat layer, you had a fibrous septum, you had your deep fat layers, and then you had your muscles. You know, liposuction tends to target the deep fat layers, which are immediately near the muscles, and cryolipolysis preferentially targets the superficial fat layers. Because if we do liposuction on the superficial fat layers too aggressively, we're going to get indentations and ripples, and obviously we don't like that. And so I think in my practice, certainly, I will often tell my patients to consider combination treatments, because we can do something with liposuction, and it's the icing on the cake. It's finesse with non-surgical treatments and cryolipolysis after liposuction.
Brilliant. Okay, thank you for that, Dr. Taimur. We've got another question from someone in Russia, I believe. Thanks for joining us. She's asking if it is necessary to check liver function or blood lipids before a crystal procedure.
Yeah, it's not necessary, because there have already been some safety studies looking at triglyceride levels, HDL, LDL, cholesterol in the bloodstream, and with serial blood test measurements of these before and after cryolipolysis treatments, and there is no increase in these levels during the recovery process. So we don't have to measure them.
Okay, brilliant. Thank you for that. Also, someone's asked us how long should the duration and how frequently the massage sessions should go on after the session. If you can tell us a bit and remind why it's important to do the massage part.
Well, the study that I was talking about looked at 10 patients, and they had one session of massage immediately after removal of the applicator. So the applicator was removed. The therapist warms up their hands and presses and massages the area and warms up the area just for 15 minutes also after the applicator has been removed. Massage probably doesn't have to be repeated. And certainly the study that I was talking about only talked about one massage therapy. I would say that if we're going to do additional therapies after treatment, rather than doing massage, perhaps we would want to consider something like diamond treatments or a crystal fit treatments rather than repeat massage. So the study just showed one session of massage.
Okay. Okay, thank you for that. Because also there's another question, that's why I'm bouncing onto it. Someone's asked if obviously you can combine the crystal with the crystal or crystal pro with the fit and with the diamond, and that was also the aim of the presentation, is to explain that combinations are possible and can be necessary, and also extremely interesting regarding the patient's needs, what the aims, what she's expecting, their expectations for their body, for their face. So, like you were saying, the massage is necessary as soon as we remove the applicator, but then maybe other treatments can come and combine with after a cryolipolysis treatment to improve the results also. Intending on the skin or the muscle.
Absolutely. So I think now, if we have one patient who says, "Look, I would like to improve my body shape. I'd like to wear a bikini. I would like to feel more comfortable in my clothes," whatever their aims are, often we will right. What is the order of treatment that we should do? And the answer to that question depends on: are you going to do all of these treatments in one session? So the patient comes into your clinic for 3 hours and you're going to do some treatments. Or are you going to do these treatment sessions? I'll do one treatment today. I'll do another treatment next week. I'll do another treatment next week or the week after that. So if you're going to do treatments on the same day, then crystal fit, the muscle treatment, that should be done first. Yeah, because that is electromagnetic waves going into the abdominal muscles. So that's the deepest of the treatments. Then we do the more superficial treatments after that. And cryolipolysis is cryolipolysis is the less is one step more superficial, but because it causes skin changes, you probably want to do diamond next and cryolipolysis with Crystal Pro at the end. So if a patient is coming on one day for 3 treatments, you do the muscle treatment first, then the skin treatments, then the fat treatments. So it's fit, diamond, pro. But on the other hand, if a patient is coming for treatments, and you come up with a treatment plan to say, you need something done to your skin, you need something done to your cellulite, you need something done to your muscles, you need something done to your to the pockets of fat that are resistant to diet and exercise, then it can be done in any order. And I would do it in the order of the greatest result. So if someone has multiple problems and multiple treatment options, the first treatment you do is the one that's going to give you the biggest bang for your buck, because then that tells your patient how it inspires confidence from your patient in you as a doctor, as a therapist.
Okay, yeah, I understand that. I hope everyone's understood that point, and that's also why you were saying at the end of the presentation that it's very important to consult, to have the patient to go through the expectations again, and to understand and to set out a treatment plan for the patient's satisfaction at the end, and the results to be attended of what they were looking for, basically. So yeah, the treatment plan is very important. Absolutely. We have another question. If during the start of a crystal treatment, if the doctor has sucked the umbilicus, should they continue the procedure? Should they stop, change the location of the applicator? Could you talk us a bit about that?
Yeah, if we're sucking the umbilicus, then it's not really the aim of the treatment. It's going to cause pain. It may cause complications. It's an area of weakening in the anterior abdominal wall. We don't actually have any safety data on what will happen to the patient if we do that. So yes, I would stop the treatment I would, and usually by the time we've realized that this is happening, we haven't reached the point of no return. In other words, it's not that it's 29 minutes down the line and we're going to do a 30-minute treatment here. We better stop it, and it's cancelled. No, we find out within the first 2 or 3 minutes that this has happened, and so we have plenty of time to stop, to change, and to reposition. And this is what I would do.
Absolutely. Also, before obviously proceeding to the actual treatment with the patient, lay down and when you're about to position the applicator, there's a procedure to do before, where you have the patient and you line it out and you see where you're going to position the applicator. So it could happen by accident, but if all that is done before, there's, like you said, it's not the aim. So there's not really a reason for it to be impacted or done. But if it is, to answer that, like Dr. Taimur has said, to stop the treatment and to reposition, obviously. Okay, brilliant. I'm just looking through the questions. I think we've answered mainly all of them, actually. Also, no, we have actually got another question. Going back on what you were saying about the frequency of the treatments for the same patient. Someone's asked, based on your experience with Crystal, in average, how many patients come back for a second treatment, and do some come back for more than 2 treatments?
I think so. If I were to put a rough guess on the figures, I would say 50%, maybe about half of our patients will have, for one particular area, let's talk about the flanks or the anterior abdomen. So will they get repeated treatments? About half of them will get repeated treatments, and most of the time they get 1 extra treatment. I think it's very rare for us to see a 3rd treatment in a particular patient, and I think it boils down to a number of things. Why would we not do 4 or 5 treatments on one particular area? Well, because the fatter the area, the more effective the treatment is going to be. That's number 1. Number 2. So as we do more and more treatments, it becomes less and less effective. But secondly, also, the fat that has been treated and which has undergone apoptosis the first time around, that is the fat that is cryosensitive. So you have cryosensitive fat and you have cryo-resistive fat. So the fat that is going to be sensitive to fat freezing, it's already undergone apoptosis. If you have a fat cell that's resistant, doing it twice, it's not gonna make any difference. So I think that's one reason. And also, I think patient selection is important. I think our patients want to have reductions because they have they're generally seeing changes with age. Because as you get older, your body lays down fat in different locations, and so I think people just want to maintain and keep themselves looking fit.
Yeah, absolutely. I agree. Thank you for answering that. We have a couple of other questions that have come through. I must say, Dr. TAIMUR SHOAIB, everyone's thanking you for his presentation and the lecture.
Thank you for coming. Thank you for.
I must say to you, thank you from them for that. Thank you for us as well. Another question's come through. Do you often encounter contour irregularities after cryolipolysis or not?
Yeah, so I think that's a really good question, because sometimes it's so effective, and you have an area of fat that's large enough for us to treat, and the applicator is of a certain size. So I think this is about planning, and this is about assessing our patients to say, well, our area of treatment is a certain size. Maybe it's about 2 or 3 times the size of an applicator, but what we want to do is we want to position the applicators sequentially in these different areas, and inevitably there's going to be a gap if you place these applicators at the same time. So sometimes you say to a patient, look, we need to do this area will fit into 2 applicators or 3 applicators, but we need to do them at separate times. And so I think that's the way to avoid it. But the other thing, it tells you that the technology works.
Absolutely.
How would we have complications like this? How would we have contour irregularities and gaps and things like this if it wasn't working? So it's obviously not nice to see, but it's reassuring to see that these things do happen. But it can sometimes be difficult to plan so that we get the right jigsaw appearance and the right combination of treatment of treatment patterns.
Absolutely. Yeah, I agree on that. It's reassuring, as you said, to actually have such a detailed problem after the results being done, obviously, and it's succeeded. We have another question, and I think it's the last, unless others come through. What is the reason we don't use the lowest possible temperature to all areas? Why do we have different, I guess, temperatures for different areas respecting the protocols?
Well, I think different areas of fat are different, have different amounts of cryosensitivity. So fat cells are sensitive to cold. Fat cells are sensitive to being overheated. And the reason I think some fat cells are more sensitive to cold is because they are at a distance from your muscles. So if you have the flank area, for example, the thickness of the flank in terms of the fat layer is quite large. There's several centimeters of fat in the flank, depending obviously on your body shape. If you compare that, for example, to the anterior abdomen, in some people, and particularly in the upper anterior abdomen, the fat there is the fat layer thickness is smaller. Now, what that means is that even though we can pinch the fat and put it into an applicator, the heat generators of our bodies, which are the muscles, are closer to some of the skin than in other areas. So, and the muscles deep to that are thicker as well and are stronger. So let's compare two areas to make this explanation a little bit more straightforward. So let's say we have the anterior abdomen where we have the rectus abdominis muscle, and it's only a few centimeters deep to the skin. And then we have the flank area, and as we go deep into that, we have our external oblique muscle, but actually it's an aponeurosis at that point. It's not really a muscle. So in the flank, we're not getting heat being generated from the muscles because our muscles are our heat generators. We're not really getting heat generated from our muscles going to the flank. And so that fat is going to be much more sensitive to cryolipolysis because it's so much easier to freeze that and to reduce that temperature. So bearing this in mind, we then have fat that requires a greater temperature reduction in order for it to be affected by cryolipolysis. So, and of course, the Deleo has done all the research into looking at which fat areas should have which temperature reduction, and so it's sometimes we leave these answers to the manufacturers and to the R&D guys, but that's the scientific explanation behind and the biological explanation behind why we have this.
Absolutely. Thank you. Thank you very much for answering these questions, Dr. Schwab. Well, look, I think we've answered them all. I was just checking, and yeah, we've gone over every single question that was answered after the presentation. So I'd like to thank again everyone that attended today's webinar. It's the first one of a long number of virtual events that Deleo is going to start putting together. So it's great to see that we had many of you attend today. Thank you again, Dr. TAIMUR SHOAIB, for being here today, for presenting it, and for answering all these questions, and also bringing us your experience, through Crystal and through the different technologies, which is fantastic for us and for everyone to also experience from your feedback. I'd like to also say that we've recorded the presentation, so we'll be able to send it through to everyone that's attended, or for those that could only attend a short amount of time today, so that will be sent through. And I'm available to answer any of your questions, or again by email, or if you need to contact us, please do not hesitate. So thanks again, Dr. TAIMUR, and I think we can say goodbye to everyone now.
Thank you. Bye-bye.
Thank you, everyone. Goodbye.